It could be a major breakthrough in the treatment of multiple sclerosis. In this week's W5, Avis Favreau looked at how some patients are responding to a brand new kind of treatment.
Paolo Ricomini has had MS for 8 years. He had 3 blocked veins that were opened 2 years ago.
Bravo.
Che ha continuato a migliorare. Prima camminavo, adesso cammino molto bene rispetto a prima.
Okay, so the breakthrough comes from Dr. Paolo Zamboni in Italy, but it could benefit patients around the world. Canada has some of the highest rates of MS. CTV's Avis Favreau is here this morning with more on the story. So to back this up a little bit, let's, reacquaint people with the disease and what is MS.
Right. Okay. So multiple sclerosis, it's a really terrible disorder. Canada has the highest rates, among the highest rates in the world. And what it is doctors have long thought it's an immune attack on the body that destroys the ability of the nerves and the brain to communicate. So you end up with paralysis and blindness, weakness, chronic fatigue, that sort of thing. And the question has always been, what starts it all? And then we heard about the remarkable story of Dr. Paolo Zamboni in Italy. And we decided with the W5 crew and my colleague Elizabeth St. Philip to go there and to take a look.
And what did you find? I mean, because he was doing some groundbreaking research.
That's right.
Yeah.
This, Beverly, is so new that the doctors really don't even know about it. They're just finding out about it. The neurologists are just hearing about it. And you're seeing pictures of Dr. Zamboni. We were the first crew in the world to finish the new treatment that he has designed. It's called the Liberation treatment. And the story goes this way. His wife developed MS. And Dr. Zamboni said, I need something for my wife. So he starts looking at what is it with MS patients? What starts it all? And he noticed that throughout history they'd documented high levels of iron in the patients of MS in their brains. And he couldn't explain why. So he went looking for what was causing this iron buildup in the brain, and that led him to work on an ultrasound test.
So using ultrasound, he began to scan the head and necks of MS patients, and that's when he made a key discovery.
In some patients, I found the evidence of narrowing of the vein.
In the neck?
Yes.
So the blood was not draining, and this is in an MS patient?
Yes, just in MS patients.
And from there?
So only MS patients have this narrowing, and it's blocked, it's twisted, sometimes there's a bone pushing into it. The blood doesn't flow normally from their head back up. Maybe that's what's pushing all this iron into the brain, and iron causes immune problems, cell death. Maybe there's a connection. So his next question was, let's see what happens if we open them up.
And that's the gentleman that we heard from off the top.
That's one of the, he's treated 120 patients. We met about a little over a dozen in the course of doing the story that he is liberating. They call it a liberation procedure to allow the blood to flow normally in these MS patients. And he has a study, Dr. Zamboni has a study coming out next week, but some of the preliminary evidence that he's already presented shows that it reduces chronic fatigue that MS patients have. They sleep better. A lot of them told us they walk normally. We have some research video, and it suggests that it stops MS whenever they're treated.
Stops MS. That's unbelievable. It just gives me chills to think about it.
Yeah, as long as these veins don't re-narrow. Now, the MS Society says too early. It's only one center that's been doing it. Even Dr. Zamboni says, please, scientists around the world, take a look at what I found and confirm it for yourself. So there are studies in Buffalo. They're talking about some in California and some other locations. But the idea is this something new that causes MS, is playing a role in MS? And, let's take a look at it.
The ancient city of Ferrara in northern Italy, a medical revolution is brewing. And Dr. Paolo Zamboni is at the center with an idea that patients with MS may have a brand new condition that may be aggravating, perhaps even causing their disease.
I am fully convinced that it is very, very important for people.
It's long been known that many patients with MS have high levels of iron in their brain tissue. Iron is toxic. It causes inflammation and cell death. But no one's ever explained why that iron is there. So using ultrasounds, he began to scan the heads and necks of MS patients. The bottom line, the blood wasn't draining out of the brains. It was actually flowing back up, where it could deposit that toxic iron, a possible mechanism in the disease. This amazing theory caught the eye of researchers at the University of Buffalo, who invited Dr. Zamboni and a group of his MS patients to join in a study.
If this is proven correctly, it will be a very, very big discovery.
The first step is prove that this is true and that it's more prevalent in MS patients than normal controls, which I can tell you immediately I believe it is.
Dr. Zamboni then wondered what would happen if he opened those blocked veins. So his Italian team began treating patients with a surgical procedure, using a balloon to repair those malformed veins. These are some of the first patients Dr. Zamboni's team has treated, speaking about their experience for the first time.
Che ha continuato a migliorare.
Kevin Lipp, an American patient who suffered with MS for over a decade, had 5 blocked areas in his veins.
One here, one here.
Treated in Italy 10 months ago as part of a study, he says he hasn't had an attack since.
It's only been 10 months. If nothing happens to me in the next 2-3 years, you know it's working.
And that is a question doctors want to answer very quickly. And one reason why the University of Buffalo is looking for over 1,100 MS patients to scan their heads and necks to see if Dr. Zamboni is right.